Welcome to the Catalyst Podcast. I'm your host, Charles Epstein. Public transit is vital to city life, but safety concerns like substance use, mental health crises, and homelessness can significantly affect the rider experience. In the St. Louis Metro East region, an innovative program developed by Bi-State Development and the St. Clair County Transit District in partnership with Chestnut Health Systems is redefining transit security, not through law enforcement, but through compassion and connection. Since 2021, Chestnut Health Systems has embedded behavioral health professionals into the MetroLink system, working alongside transit security. They provide real-time support to riders in crisis, addressing issues before they escalate, and connecting individuals to essential services. Joining me today to discuss this amazing program is Nathan Zeller, Associate Director of Recovery Support for Chestnut, and his colleague Dennis Watson, Senior Research Scientist, also with Chestnut Health Systems. Will discuss their role in the program, the barriers in its implementation, its successes thus far, and what could be learned and more broadly applied from the program. Dennis joins us today from Chicago, and Nathan joins us today from Granite City, just outside of St. Louis. Gentlemen, thank you for joining us and welcome.
Thank you.
Thanks for having us, Charles. Appreciate you.
My pleasure. Really been looking forward to having you guys on this podcast to discuss this amazing program, as I mentioned. So first, tell our listeners a little bit about yourselves and your work. Nathan, let me start with you.
Yeah, so as you mentioned, my name is Nathan Zeller. I'm the Associate Director of Recovery Support here at Chestnut. My journey with Chestnut actually started as an individual who received services here. I went through our drug court program, went through intensive inpatient and outpatient services, and went through residential treatment up in our Bloomington location as well. One thing led to another after completing that program successfully, and I was asked to be a recovery coach on one of our access to medically assisted recovery grants that dealt with individuals receiving like medication-assisted recovery, such as like Suboxone, Vivitrol, Sublocade, those types of medications, and trying to connect those individuals to recovery support or keep them engaged in the recovery process and to minimize any barriers they had to the recovery process. Eventually, that led to a role as a behavioral health outreach specialist on the MetroLink project. Myself and another person, the coordinator at the time, were the first two individuals to start the project in St. Clair County. And we'll get more into that, I believe, a little later here in the podcast about kind of what that looks like.
Great.
I was involved with that program for close to 2 years, and then a position became available for me to actually oversee recovery support staff on that first grant that I worked on that access to medically assisted recovery grant. So I oversee some, well, now it's changed quite a bit over the past years due to funding and grants that have come and gone, and now we have so many different grants. I oversee in-house recovery support staff at our 3 locations here in the southern region at Belleville, Maryville, and Granite City. I also oversee the recovery support staff on the MetroLink project, and there's a couple other smaller grants we have that I oversee the recovery support staff on that involves a Madison County Transit project that we just started here 3 months ago. And there's a WARM grant we got through the state of Illinois that I also oversee the recovery support staff on that as well. And then there's one small Madison County funded opioid settlement grant that we have a recovery support staff on that I oversee as well.
So they're keeping you busy.
They're trying to. They're doing a good job of it. Let me put you that way.
It sounds it. Dennis, a little background, if you would.
Yeah, so like you said, I'm a senior research scientist at Chestnut out of the Chicago office. I'm trained as a sociologist, behavioral health researcher by practice, and most of my research focuses on substance use disorder recovery for individuals who are interested in stopping or reducing their drug use. How can we support them? How can we get them there? That includes understanding peer support interventions, which have sort of exploded in the past few years with a lot of different funding opportunities and certification programs that have developed nationwide. And then I'm also interested in harm reduction supports and outreach. So how can we best help those who choose to continue using drugs and help to keep them, their loved ones, and their communities safe? And I have been connected to this specific program through some work that I've been doing with trying to build more connections between Chestnut as a health system and the Lighthouse as a research institute within that system, and particularly really just having an interest in what this program is doing because it's unique, and taking, what time I can in my extra time to go down and observe, learn about, collect data. Mostly has been through observations and interviews with people at this point, to really understand the program, what it's doing, and document what's happening with it. We currently don't have any actual funding to support any of these research activities, which is why it's sort of when I'm able to get down there and when I can do that. And so a lot of what I'm also focusing on is what can we learn about the program that can help us to figure out how we can initiate getting funding to do a more robust set of research activities related to the project.
Tell us how the program works, Nathan.
Yeah, absolutely. So when fully staffed, we will have 10 staff members on the alignment. We have right now in St. Clair County, we'll have 6 full-time staff. So we have 2 staff that ride the train in the morning, start at 6 a.m. They get on the MetroLink, and at the Belleville stop, we actually have an office that was built for us at that location specifically for our team by our funder, St. Clair County Transit District. Our team has all their supplies there. They hop on the alignment and they go out and ride the train from starting at Belleville all the way out to Shiloh Scott, which is the last stop in the alignment, and then it goes all the way over to Lacledes, which is the first stop over in Missouri. That's the easiest way for our team to transfer over to a different train and go back, and they just ride the alignment all day. We have a team that starts at 6 a.m. in Illinois and works until 2, and we have another team that does the same thing on the train alignment where they work from 11 to 7. So a little more of an evening shift where we're trying to catch riders at different times and at different locations as well. Also in Illinois, we now have started a team that the hours on this vary, but usually it's either 6 or 8 a.m. and it's an 8-hour shift. So it's either 6 to 2 or 8 to 4. And this team is specific to working on the bus lines. And so while they don't ride the buses, they actually go and they get in a Chestnut provided vehicle and they ride the actual bus routes. And so all through St. Clair County, and also focusing a lot on the actual MetroLink stops themselves. We've kind of focused a little bit more on that because our teams, when they're on the train, they're mostly just riding through there. They'll hop off from time to time if they see somebody that they need to engage with. But for the most part, this bus outreach, we call it the bus outreach team, focuses on the actual MetroLink stops and also the bus stops in St. Clair County that have been highlighted by the funder as problematic areas or areas that may need our services.
Yeah, I'm curious, what is the nature, generally speaking, if you can generalize, of the interaction? How have the interactions initiated?
The interactions can be initiated in multiple ways. So our team will observe individuals, and if they feel it's an individual they need to go up and engage with, they will go up and engage with that person, try to screen them and see what type of services they may be interested in. So this probably won't be surprising to you. A lot of people aren't interested in services originally. And so a lot of what our team does too is relationship building. They see a lot of the same people riding the transit throughout the day or throughout the day, throughout the week, throughout the month. And so building relationships with them. And when this person is ready to get into services, our team is there. There's also the security staff that our team is with and that is assigned to us from bi-state development. They will also engage with individuals. We've gotten really lucky with that. I know Dennis, really, that's kind of one of the big differences about our project that Dennis has kind of mentioned to me in the past is the buy-in we have from the security staff with bi-state development. And so there will be times whenever interactions are started by them and the security staff will come up to our team and say, hey, we have this person here. Do you mind if you go and talk to them? There's also other security staff out there. The security staff on the alignment, they have different roles out there. And so there's another security company that is more in charge of fare enforcement that will also call our team and say, hey, we have this person down at Fairview Heights. Can you come down and engage with them? They're in need of maybe getting into a shelter. So that will happen as well. And there is rare occurrences. It doesn't happen as often now, but it used to in the past. Whenever there's also St. Clair County Sheriff out on the alignment, and they will also call us from time to time to try to engage individuals as well.
Right. And I'm assuming that they're also there to sort of backstop situations,
Yeah. Yep.
which become situations,
Yeah.
if you will.
And I also want to mention too, we also have a team in Missouri that is exclusively on the Missouri side of the river. And so we have when fully staffed, we have a team of 2 that will set up at the Civic Center, which is the hubbub of the transit traffic in the St. Louis metropolitan area. You have every bus coming in there. You have Greyhound, you have Amtrak, you have people from all over St. Louis coming into the Civic Center. And that's kind of the transit hub there. And so we have a team of 2 that is set up there that is just works specifically at the Civic Center all day. That's all they do, is they engage with individuals, those same ways that I just mentioned before of how the engagements can start. And then we also have another team of 2 when fully staffed that goes out and rides the alignment specific to Missouri and in St. Louis. And they'll ride all the way out to the airport, or they'll hop on. There's 2 different lines on the alignment. There's a blue line and a red line. And so they'll hop on both of those alignments and try to engage with individuals on the train in St. Louis.
Yeah. I want to get to some related questions, but Dennis, since Nathan name checked you in his response, do you have anything to contribute, anything to add to that?
I'll just say when I first heard about the program, I thought I understood what it was about. And then I went down and observed it, and it is way more nuanced and way more complex than you can do justice in just talking about it. You really do have to see it in its operation. One of the key things that I noticed is that the workers, the outreach workers, are really there and engaging with everyone. They're not just targeting individuals who have, an identifiable behavioral health issue, because you can't always see that, right? You do have to engage people to let those issues come out. You have to build trust with individuals so that they feel comfortable to say that they need help with something, or to say that they need, they may want help with something that a service provider might not see as the main issue, but they see it as more important. And you have to meet them where they're at and where they're willing to engage with you at. So I've really noticed that, their workers don't just learn, oh, wait, I'm sorry, you don't have a substance use or mental health issue, I can't help you. If someone says that they have a need for them, they take that information, they try to get back to the person, they'll take their phone number, and they're really doing a lot of work to form relationships with the riders across it. And I have seen instances where riders will, who do not have probably a mental health or substance use issue themselves, will grab an outreach worker and say, hey, I think this person over here needs assistance or something. So forming those wider community relationships is really a huge part of their work that I've seen before. I think something else that is hard to describe that, as Nathan talked about, you've got this Illinois side and the Missouri side, and you've got people that stay at the Civic Center versus people who are or outreach workers who are riding the alignment. That nature of that work is very different depending upon which side of the river that you're on. So just to give you an example, at the Civic Center, a lot of the engagements that are happening, and by the way, this place is a hotbed of just activity going on all the time. It is a busy place where tons of bus routes, train routes, there's a Greyhound station close to there, an Amtrak. So there's a lot of commotion going on. So those workers are constantly busy. And what I've noticed there is that they have a lot of people, because they are stationary and people know that they're there, they go and seek them out there for help. Versus when you're riding the trains, it's more being vigilant and identifying people who need help. And then on the Illinois side, there's not as much ridership happening. So there is an opportunity for folks to really engage and get to know people and understand their problems, have longer conversations with people. Where on the Missouri side, it is much more quick interaction because just the volume of ridership on that side is so much more. And then also, I just want to say this has been amazing to me, is the amount of coordination that happens between those teams. So just, knowing like, oh, you engage someone on the Illinois side who is from Missouri and trying to figure out how do we pass this person off over to that team so that they can get them the services they need and vice versa. Sure. Now, I do want to just mention, because Nathan specifically pointed out the security, I was originally very suspect at the fact that they were leveraging security just based on work that I've done in the field, and seeing sort of that divide that can be caused, and that closing off when police or security are involved in interactions with people who are experiencing homelessness or using substances. And I have just been amazed at how well the security works with the outreach workers. And they do really have these, they know what their role is, and their role there is to provide security primarily for those staff, and they step back and they let those staff do their jobs. But I also
Did that
think
happen over time? Was there initial resistance to this among law enforcement types, initial resistance that was overcome over time?
I could guess at the answer, but I think Nathan's better to to address that.
Yeah, absolutely. So originally, when the project first started, we actually did not have any security staff assigned to us. And so we rode around with what they were called, and they're still called this as ambassadors for the alignment in St. Clair County, which is basically just a couple of individuals that were familiar with the alignment, familiar with the ridership, and their goal was just to get us familiarized with riders in particular, but also the alignment. After a couple of months, security, it was suggested by State Development that we have one of their security staff ride with us. And to your question, I would say there were some growing pains at first of each of us trying to figure out what our role was. We were blessed to have the original security staff that's still with our team today. Is she kind of has a bit of a background in social service work herself, so we were really lucky to get that. But I will say, like as Dennis mentioned, like we each have different roles out there, right? And so like the security staff job is to keep us safe, and like then our job is, as the social worker, we want to help everybody we can, and sometimes there were instances where there were some difficult conversations that were had, and like it didn't go the way that I personally didn't want it to go, but like there's a reason it went that way. And so like I will say today that our relationship with our security staff is really, really strong. And I think it's one of the things that makes this project really, really go well is that relationship with them. Because as I mentioned, like it is not out of the ordinary for our security staff to go up and start just engaging with riders themselves and just talking to them and asking them questions and then saying, hey, I have this guy over here. Do you mind going and speaking to that person?
So that I'm sure was an evolutionary process.
Yes, it definitely was. It definitely was, and it like for the security staff, they also like I try to put myself in the perspective. I'm obviously not security, but like again, their role is to keep us safe, and so like the people we're engaging with are to be honest with you, like there's some people see them as not being safe for individuals that we need to be engaging with. So for them to allow us that freedom to engage with these individuals and try to connect them to services, that really is what made this project kind of grow and thrive. Because had we had security staff that would come in and step on every interaction we had, we would never be able to build those relationships with people when we're first talking to them and we see them, every day and saying, hey, how you doing? Like if we weren't able to ever have that leeway to do that, I don't think this project would ever succeeded the way that it has.
When you did implement it a couple of years ago, were there any other programs of its kind out there that you patterned this after?
Dennis, I don't know, Dennis may know a little bit more about this than myself. I know, like, so originally we met with a team in Kansas City, but they were doing something a little different with the bus lines. But for us, like, we kind of we did not have anything to specifically pattern off of. I think, Dennis, you kind of know a little bit more about that, correct?
Not much more. So I do know that there were, I think there still are, but 2 programs here in Chicago that are run by different agencies on different lines. They are a very different model. They, for instance, do not use security, and they specifically do not want security as part of their teams. And I think that is something that is always, like I said, I was skeptical when I first heard that they had security involved with this project, but I think it really works down there. And one of the reasons I think it works there compared to what it might in another location is because I have never been on public transportation where security, just in general, not even when I'm with the team, when I'm by myself down there riding the metro, security's everywhere. They are everywhere down there. You see them all the time. You can't hide from them really like you can. I rarely ever see security or police in Chicago. And so I think because they're there, they're always there. They're part of the backdrop, that it's much easier to have them be part of the team than it would be in a location where you're not encountering them unless they are reacting to a problem, right? And so I do think that is something unique about their program that may or may not work somewhere else, depending upon how security functions in that other environment.
Right. Yeah, no, that's an excellent point. Can you share a specific success story, maybe something that's emblematic, where this approach made a real difference for a writer in crisis, Nathan?
So I mean, there's the obvious ones of the Narcan administrations we've had when we've encountered individuals that were overdosing from a substance, and our team has had to administer Narcan and revive them back to life. And so there's those. There's several instances, like one of our leads on the project. He is really great at engaging with individuals and connecting with services, and so. He's set up specifically at the Civic Center, and he shared a story with me. You mind if I share that one?
Oh, please, sure.
It's just a short one. So he had a rider that had shown up to the Civic Center with some with some Hot Wheels one day, and then Shane remembered who he was because he had talked to him several times before that. Rider was in active addiction, was using fentanyl actively, and Shane talked to the rider about possibly getting into MAT or MAR services, so Suboxone and Vivitrol, and trying to get that individual connected to those services. The rider was able to make an appointment for those services the next day, and then was able to also continue to work with Shane to get into a shelter, which led to him also eventually getting into long-term housing. So that type of interaction is what our team has. There's another instance. We're over here on the Illinois side of the river where one of our teams had worked with a rider for a really long time of trying to build up rapport and trust with this person. It was someone who was living in the woods right off the alignment. And so eventually, through multiple interactions with this person, they were able to get them into a overnight shelter, which then eventually led to them getting into a detox and then getting into residential treatment.
What I've learned in speaking with your colleagues, so one of the things I've learned is how important improvisation is when you're out in the field, and how you have to be agile, how you have to adjust to circumstances. And I don't think anything exemplifies that more than the people working this program.
Yeah, absolutely.
It's really remarkable. Does it require any specific kind of training to do this work?
Most of our teams right now are peer support staff. We do have our individuals that identify as having lived or living experience. I think of the now 10 full-time staff that we should have starting later this week. I believe 8 of them identify as individuals in long-term recovery or lived or living experience. And so we have a training process that we set up through our in-house training. And we also work through a company called the Niche Academy that puts real-life scenarios onto into a training format, and allows our team to train doing real-life scenarios.
What does success look like for this initiative in the long run, and how do you measure its effectiveness?
To me, success is obviously subjective to each person. Like Dennis may see success differently than I do, but like for us, our team's out there every day providing services to individuals and connecting them to those services. One thing I'm really proud of with this project is, and you asked this question earlier about, was there some resistance with some of the security staff? And so when we first started this project, I would say there was some apprehension. I don't know if I think they probably thought, what are these, or how are these people going to come in and help some of the ridership on the alignment? One thing I'm really proud of that I consider a success is today, like it is common phrase to say you hear is, hey, call Chestnut. Chestnut will come and help this individual. To me, that means we built up a name and a recognition out there, and people know, like when you call us, We're going to come down there, we're going to engage with the individual, we're going to try to get them into services, and we're going to treat the individual with respect, the rider with respect and dignity. And for me, that's a success right there.
Yeah.
The data is the data. I mean, we're up over 6,000 engagements over the project now. I can, if you want me to share some of the data with you, I can. But to me, like us fulfilling what our obligations are from our funder, and also from just in general and as individuals who are, most of us are lived and living experience, and working with people who are in active addiction or unhoused or experiencing mental health. If we're connecting people to those services and trying to get them into a service that they're interested in getting into, that's a success to me.
Dennis, thoughts?
I think the hardest thing to measure, because a lot of it right now, because like I said, we'd love to be able to find a way to do some more robust research with the program. So right now, a lot of the data, because we don't have the support for that, is focused on service engagements that can be counted. We're not really able to follow people long term to see what the ultimate impacts are, which would be wonderful if we could get the resources to do that. But I think the hardest thing to measure that I see happening when I'm looking at things qualitatively when I'm down there mostly, right? I'm observing the workers while they're doing their job. And it's the prevention that's happening, the problems that aren't even getting recorded, that they probably don't even realize they're having a huge impact on people, whether it's just, I think one of the best examples that I'm sure it got recorded somewhere, but it wasn't a service referral. It probably just got recorded in some notes. But, just being able to witness where someone was having a behavioral health issue that was acting out, that was not a threat. It was just making other people uncomfortable around them because they were dancing strangely. And, and one of the workers just, helped that person through that. And the person just was able to walk away. But there were police getting called. There was security there. I mean, if that worker hadn't been there to prevent that and to redirect that situation, that person probably would have gone to jail at that point in time. So, and again, there wasn't a service referral that I saw. It probably might not have been counted in the data. It was probably counted as an incident in some type of note somewhere. But it was a really powerful thing to see as someone who's been studying mental health for 20 years, to see someone be able to engage someone like that and redirect that situation.
And Dennis, I know I've talked with you about that in the past, about like one of our funders with the St. Clair County Transit District had mentioned, like, I said, I don't think you guys realize how much of an impact you have just by coming out here and talking to people and treating them with some dignity and respect, and listening to a population that is never listened to. And the effect that has had on the de-escalation of incidents on the alignment, and the effect that has had on the ridership itself is something that, unfortunately, we don't have a number for that, but it is something that does exist for sure.
Occasionally we do give flowers out here on the Catalyst podcast. Uh, what for other cities or regions looking to implement a similar model, what key lessons have you learned that could help them succeed?
I think you have to have buy-in from everybody, all your partners. I go back to the security part of it. If we didn't have the buy-in from, Bi-State Development and St. Clair County Transit District, the two funders, if we didn't have that buy-in, we wouldn't be where we are at today. We would have never had the security that is with our team, that allows our team to go out and actively engage with individuals. So that buy-in is very helpful for me. Also, I think it's important to realize, like, if you're a behavioral health organization, and like this is something that we really focus on with our teams, is like, for us, we don't want our teams to only refer people to Chestnut, right? Like, we want to be able to use all the community resources that are available to our teams and to the individual, because sometimes for the rider, for the individual, Chestnut's not going to be the best fit. Like, Chestnut doesn't have a drop-in shelter at this time, and so that means we have to build partnerships with some of these community-based agencies. So having those partnerships with those community-based agencies, and being able to refer individuals to those agencies and what works best for the person that we're working with at that time, for me, that is something that is really important to make something like this work as well.
I have to think that you guys have such a powerful message vis-a-vis going out and seeking additional funding for the program. What I find particularly compelling about it, particularly in the moment we're in right now, where every dollar has to be justified, and even then you're not sure, is how intelligently you leverage existing infrastructure and resources. the mass transit system and all the other resources outside the immediate scope of Chestnut. It's just a really smart program. As I said, we are very generous in issuing these flowers on this podcast. Any closing thoughts? And I do want to add this, Dennis, early on, you said that you really have to see the program to fully appreciate it. You guys did, and I don't know who was responsible for the production of it, this amazing 5-minute video. Anybody who sees that, I think it's a very vivid demonstration of the program, how it works, its efficacy, the nuances, and so on. You see these people riding the trains, riding the buses, talking to the camera and doing their work. The URL is going to be posted into the description of this podcast. I encourage anybody listening to this, check it out. It's a real eye opener. Any closing thoughts?
I just want to jump back to the thing about other cities looking to implement a similar model, because I think that the things that I've been very impressed with, I've been studying peer supports for a number of years now, and this is probably one of the best programs in terms of supporting their staff that I have seen in terms of the supervision that they receive and the resources that they receive to do their work. And I think that that is really key to replicating this type of model. And what I've seen down there is that, it's supervision and it's coaching and it's backing, giving them the room to make their own decisions on how to intervene, and then supporting those decisions and walking through why they made those decisions. That I think helps to build an outreach staff that is comfortable in being out there without a supervisor looking over their shoulder and making on the spot decisions to connect people to resources or intervene with folks. But I also think one of the things that has been key that the staff have told me is extremely wonderful to them that I've never seen before is something that they call reflection. And I'm gonna put Nathan on the spot and just have him say what that is. But I believe that that has been a key thing to helping them work through what they're doing in their work. And I would recommend that anyone doing a similar program think about including a similar type of strategy.
Yeah, thank you for that, Dennis. So yeah, that's kind of what I was thinking too when you asked the question there, Charles, is the investment we try to put in our teams as far as time, not just a financial commitment or anything like that, but the time we try to spend with our teams, because this is a very difficult job. We're coming across the individuals that our teams are working with you see a lot of people in some extreme situations, and having done the job myself, like there are still instances where I have some trauma from doing the job of stuff that I've seen out there, especially like, as I mentioned, most of our team are individuals who identify as being in recovery or have lived and living experience. And so one thing we've learned with the supervision of peers is there's sometimes that, peers tend to take things a little bit more harder than some other staff may tend to do that. And so we started what is called reflective supervision. And so what reflective supervision is we have partnered with an outside agency. The clinical staff that runs that agency actually used to be a therapist here at Chestnut, but he now has his own company. And our team goes in and meets with them, depending on what everybody has set up. But like I try to do it once every 2 weeks. So I'll just use myself for an example. It's a safe place to go in and talk with somebody about how the job's affecting you, how the job's affecting your recovery, how the job's affecting your home life. Basically, our team calls it workplace therapy. That's what they call it. That's kind of yeah, that's kind of the little name they give it. But at the end of the day, it's a safe place to go in and talk about how things are affecting you. And for us, like again, for myself, it was really, really helpful in processing this job, because again, you see a lot of stuff out there that you're not used to seeing. You don't see that type of stuff in the office setting. I can assure you of that. And so it's been really helpful for our teams, and I feel it's really helped grow our teams. And I'm a big believer in we're never going to be out there holding everybody's hand doing the job. Like everyone knows that we train people to do their job, and if there's problems, we address those problems. But everyone is really capable at doing the work, and so we try not to supervise from a microscopic level, if that makes sense, and we let people do their job.
Yeah, I'm going to sound like a broken record because I end every conversation on this podcast with your colleagues by saying you're doing amazing and important work. And I really applaud everybody, all your colleagues, and you guys particularly, because this truly is an innovative, amazing program, and I wish you continued success with it.
Thank you. Appreciate you having us on.
Today, I spoke with Nathan Zeller, Associate Director of Recovery Support for Chestnut, and Dennis Watson, Senior Research Scientist, also with Chestnut Health Systems. Dennis joined us today from Chicago, Nathan from Granite City outside of St. Louis. This is Charles Epstein, the host of Catalyst. Thanks for listening.